A very good evening to everyone who's just joining us at Kopi with Vans. But you know what? Nowadays, the Kopi is missing in the show. That's right. It's because of the humid. The weather is crazy. So we're drinking lots of water. But that doesn't mean that we're going to change the show to water with Vans, but still Kopi with Vans. But I'm not sure because if my guest speaker today stand by a coffee or Kopi, right? Because it's always a surprise. Thank you for joining me again on Kopi Events every Wednesday, 9 p.m. without a fail. So today's topic is all about women, and today, of course, you can see from the the topic wellness for women. But before I invite my guest speaker up to have a great conversation on this topic, recently I did a post on regarding about a event that I went for a short break. It's about Mother Nature, right? Why is it Mother Nature is always referred as a woman? And then I started to realize because the beauty of it is she's humongous. She has a lot of patience because if she get angry, a lot of stuff can come up like tsunami and all these things. We don't want to talk about it, but at the same time, she can able to have that elegance in her, right? The beauty about her. But even if we're going to dive in more to the topic, the best person to talk with us is Dr. Mythili Pandi. Let's invite her up. Hello, Doctor there.
Hello, hi, how are you?
I am
Thank
good.
you for
How are
having
you?
me. I'm very good, thanks.
As usual, I'm not sure if you have any coffee on your side.
Water, ice water.
All right. Thank you. Thank you, Doctor, for joining me today on this beautiful topic of wellness for women. And I know we're going to talk a lot of it on related to the health aspect. But before going on, and I think it was very that sorry, it was very interesting that I found something about you. You train 5 times a week. Is that right?
I try to. So most weeks I would have three HIIT sessions,
Okay.
one strength training session, one Pilates
Wow.
session,
Right.
and I try and do one run in a week.
Wow.
So
So you do that. Okay. Okay. So I'm talking to an iron woman right now.
no. No. Far
Um,
from it. I basically keep my head above the water. That's basically all I do.
Okay. I think you're not just only talking about it, but I think you're walking about it. And I think keeping fit and healthy, not just by words, but I think you are proving it. Thank you, Doctor, for joining me in the Wellness for Women topic today. Let's dive into the topic. Before we even go into the topic itself, I mean, it would be great because even though we have all the informations for the viewers to know who you are, but it will be best if you can do an introduction about yourself, Doc.
Yeah, sure. Okay, I'd love to introduce myself. My name is Mythili. I work as an integrative medical doctor. So I'm a family physician. I see anyone who is born to the very last days of the person's life. My special interests are in women's health and nutritional health as well. But I think above all, I am a lactation consultant. So I work with women and babies to get on the best footing for their breastfeeding journey. That's what I do in a nutshell. Oh, but that's just my job. I am a mother to three beautiful children. They're 12, 10, and 8, and two fur babies. They are 5 and 6 years old this year.
Right. So yeah. So you're keeping yourself busy with your workouts, with your passion, and at the same time a lot of stuff that you're doing. Thank you, Doc. I mean, it's going to be very interesting for today's topic. Before we even want to go into the questions that I've set up, I mean, we have set up for a few of the viewers, and viewers also have sent in. Even when you talk about health, why is it that a lot of women falls under a lot of health issues, especially after pregnancy? You know, the fibroids, the PCOS, so many things. Is that because of that woman's body or the hormones is changing?
Very interesting question. And it's so loaded. Okay, so let's talk about what happens in a woman's. I don't know. Should I just jump right into it, Vance?
Yeah, yeah, please jump in. Jump
Okay,
in.
okay.
Yeah.
All right. So I think one of the most important things that we need to remember is that a woman loses blood on a monthly basis, right? And when that happens, what usually happens is basically losing blood, you lose iron, you lose a lot of volume, and your body undergoes quite a lot of rejuvenation in that sense. Because, if you think about your menstrual cycle, you are really taking on a health check on a monthly basis. If your periods come on time, okay, everything's well and good. If you're not losing too much blood, okay, everything's well and good. But when we start losing blood on a regular basis, your body needs to replenish it. And that takes a lot of energy, that takes a lot of resources, iron, inflammation that takes on before, things can happen basically.
Yep.
And when things go array, when things don't go according to plan, that's when trouble starts to kick in. So we talk about fibroids. What is a fibroid? Why does it happen? No one really knows, but we know that it's an abnormal growth of tissues. And that's my mom there. Hi, mom.
Hello, Auntie.
um, and so, when we talk about these sorts of things, abnormal bunch of cells that have just started to replicate. And when that happens, sometimes, it just starts to cause more issues in the body. So I think a lot of it stems from the monthly cycles. And then, of course, the surge in hormones. Every single time we have a cycle, there's a change in the hormone levels. Think about how it is with men. In men, it's constant, right? There's nothing that changes, well, pretty much nothing that changes on a day-to-day, month-to-month
Yeah.
basis. But in women, we're cyclical beings. We're supreme beings. And so when that happens, because of the sheer nature of our cyclical hormones, things just go away. Things happen.
Dog, I can't imagine, right? Women go through a lot of stuff, right? I mean, during the childbirth, the kind of pain that she go through is unimaginable and unexplainable. But when we're talking about these menstrual cycles, every month, it becomes very inconvenience, and it moods, because we are going to talk about the mood changes in the next question. But can't imagine, right? If you're losing blood every month, think about the iron or your whatever that's going through. I mean, how do you, is this some, I mean, for me, I donate blood, but every time when I donate blood, I get very weak. But woman does that every month. So, wow, it's amazing.
So, yeah, I mean, because of that, we often recommend that women do not donate blood. That's why the criteria is so strict when women are meant to ask to donate blood, right? They need a hemoglobin level of above 11.5. And already, if
Yeah.
you think about it, grand scheme of things, your HB, your hemoglobin level, should be way above 12.5. And that's normal.
Right.
So anytime it steps below 12.5, we can consider that anemia, right?
Right.
So yeah, okay. Anyway, so back to your question. Yeah, so we actually lose a significant amount of blood on a monthly basis, significant amount, and we can actually quantify that from anywhere between 40 mils, right, to 80 mils, and sometimes even more. Some people actually bleed bucket loads on a
Yeah.
monthly basis, and we're just giving back to Mother Nature, I suppose, in the grand scheme of things again.
Yeah. And I can't imagine if men have to go through this on a monthly cycle.
Oh, even
I
a
mean,
normal flu is called a man flu, right?
right, but no offenses to the males out there. I mean, I represent them, but we have to give it to the ladies, to the women who go through monthly. Can't imagine, the kind of energy system they go through every month and replenish. But having the same line as we are going to talk about, they have moods as well. I mean,
Yes.
hopefully my wife is not hearing this because she's a bit busy, but probably she'll hear that after that. But post is okay. But they get these mood changes very, from Mother Mary or fairy tale to, sometimes angry. But what exactly is happening, doc?
Okay, so when our hormones start to shift, okay, so if you think of a 4 week cycle, the first 2 weeks, the hormones start to increase, and that uptick actually makes us feel energetic. It might kind of make us feel like we've got it, we can rule the world almost, right? So if you
Right.
break it down into 4 seasons, so 4 weeks, 4 seasons, the first time, day one is when your menstrual blood losses start. That is basically when you start to want to be in your little cave. You don't want to talk to anybody. You don't want everyone is, you're like, you're gonna pounce on them, right? You're really angry, and you
Yeah.
just want to be on your own. Okay, that happens in the first week, and usually in a couple of days, about maybe 5 to 7 days, you start to want to creep out of that little cave and you start to be outside and you want to talk to people again. And you start to maybe start to flourish a little bit. So you're wanting to make conversation, nothing too heavy duty. You just want to, start having conversations. Then week 3, that's when summer is. And summer, you're blossoming. You're taking things on. You're just, wanting to achieve and to rule and all of those things. And
Right.
so that if you want to plan anything, like signing documents or taking on a new business, that's when you should be doing it.
Right.
Then the last bit, so week 4, just before we go back into our caves and retreat, things start to slow down. You don't want to make any big decisions. You start to get a little bit edgy, a little bit moody, and then you go back into your cave again during winter. So if you look at it that way, you can understand that when hormones start to go up, our mood starts to increase. And then as they come down, then the mood starts to go down again. So it's again a cyclical nature of us being human and us being women.
Right. So the mood changes is quite common. And I mean, how about if you do meditation or some kind of relaxation? Can a woman can able to control that, or is it that it's a kind of a way that they have to show it, express it out, right?
Oh, I'm a huge fan of meditation. I try and meditate every day,
Right.
and I think it does help us, kind of get our emotions into check. But it doesn't mean that we don't have these emotions. Okay,
Right.
it's a
Okay.
beast.
Okay. I'm married for more than 19 years. So yeah.
Congratulations.
Okay. So yeah,
You're not
I'm
dead
not,
yet.
really have to do the meditation right now, right? But of course, on a serious note, that could be also a lot of changes happening on a woman, all right, monthly, right? They go through a major change, and of course, uh, great endurance are there, and they are going through this. But also in the same line, it affects the menstrual cycles from the female body. What kind of effects, apart from these mood changes that we talk about? Do they also have lose of appetite, or they get very demotivated? It's also a part of psychology as well. Well, that affects the psychology as well.
Absolutely. So if you can imagine in the winter parts of the month, you start to get a little bit tired. You just want to stay in bed and you want to rest and relax and do very little. And your body's weaker. You're losing blood. So in yoga and Ayurveda, that's a time where you don't want to be pushing yourself too much. You don't want to be exercising too much, right? And then during the spring seasons, your energy starts to pick up a little bit, and that's when you can start to do a little bit more, right? And that's also the time when the follicles, the eggs, right, are starting to be nurtured and they're starting to
Right.
grow. Then summer comes, and then you're perfect bikini board, right? You're just raring to go. You've got the energy, you're surging. But also not really bikini board, because that's also the time where we start to ovulate. And during ovulation, there is breast tenderness, the breast starts to swell. There is a little bit of water retention because ideal female body is like those Hindu goddesses,
Yeah.
very shapely.
Right.
That's the ideal body in the humanistic sense.
Very
Um,
interestingly, Doc. Sorry, I just have to say this to the viewers and to yourself. I happen to watch a couple of your Instagram stories. Very interesting. You put dinosaurs. Am I right to say? Is it dinosaurs?
yeah, T Rex.
Always in that. And I think the way you educate people or your friends and families, whoever in the social media, of how to take care of the breast, what are the things to look for, and I think it's a very great educational video that you are doing. And what inspired you to do this?
Oh, gosh, it's a long story. But so I decided to do lactation work and basically natural medicine. So nutritional medicine is what we
Right.
call it. Because I've had quite a lot of medical issues in the past, and one of them was a very serious autoimmune condition where I felt like I was just losing my joints. I just didn't have a joint anymore. I didn't have my wrist. I didn't have a knee. They're very stiff. So I woke up with that kind of stiffness for a whole month before I decided, okay, I need to get this checked out. Because doctors are the worst patients, right? So when I found out that I had this autoimmune condition, I realized that I needed to know more about why this is so and what I can do to prevent it in the future. And because of all that learning that I did to find out more about this, I thought that, hey, this is more interesting than medicine. And I need to impart this information that I have to as many people as possible so that people understand it, people learn it. And in the same vein, breastfeeding, because that's preventative medicine at the very core. It's basically how to get the next generation getting going, right? How to get them on the best footing for the right from the beginning, the start of their
Right.
lives. And that's basically it. That's what I love doing, and that's what motivates me. And that's what gets me out of bed every day.
I'm definitely going to share your IG address of Instagram's URL over in the next couple of minutes, so that viewers out there, you should watch videos from Dr. Mythili Pandi. It was very interesting. Woman, actually new mothers, or for the first pregnancy, what to expect. I think she explains it very clearly, and I think they are very educational for women to understand what they go through, because it's the first time if they're going through. Thank you, doctor, for that. Some women sometimes try to conceive and then not possible. Some even happens after 5 years. Some say it's because of stress, because of some genetics. What is your take on this, doc?
Oh, this is an interesting topic. Fertility is something that, well, basically, it is a state where your body is then ready to bring on a new child into the world, right? And so, if your body is not quite ready, if you are nutritionally deficient, you're not having enough iron, vitamin D, B12, folate, even your thyroid function's all out of whack, sometimes it doesn't quite happen the way we want it to. So, and your body is always trying to protect itself. If you are eating something wrong, think about
Mhm.
it, right? Let's say you eat too many murukus because it's Deepavali, and your stomach gets a bit bloated. That's your body's way of telling you that you maybe should cut down a little bit. Do you know what I mean? So, same thing. If you feel like your body is not quite ready for it, get tested, get checked, find out, do the nutritional tests, because not every doctor understands this. So find someone who is willing to work with you on this. Sometimes it's a naturopath, sometimes it's a doctor who can read these tests for you, do the appropriate tests. And that usually works quite well for my patients anyway. So, in terms of when does it happen, I think it's usually when your body's ready, right? Things don't happen. I mean, we've got to trust our human body. It's given us so much already. So sometimes even allowing things to happen in its time, but given the right resources, it would happen.
Right. Earlier, before the show starts, I was having some muruku. And I think you saw it. So probably when the muruku topic came in, I was like, oh, did you?
I have my secret stash here as well.
Oh, oh my God, what's happening now? It's a season, right?
It
People are
is.
wondering what is this physical guy, the fitness and doctor. I mean, we enjoy our food, but at the same time, we train. Disclaimer. Okay, Doc, I'm going to go into a little bit more deeper as well. We talk about the mood, we talk about the effects of the menstrual cycles. We also talk about what happens during the hormones during that month. But it's also becoming quite, what shall I say? It's becoming quite often we hear this endometriosis, fibroids, PCOS. Um, what are the chances after a woman has delivered of getting fibroid? Because most of my clients, I hear these words fibroids during they have removed it, and some said just observe. So what is your take on that?
Okay, so fibroids are really just an abnormal growth of cells in the uterus, right? So that's the womb. And it's not a cancer, but it can cause quite a bit of alterations to the shape of the uterus. And that may mean that you can lose a bit more blood when you have your periods, right? It can also cause a shape. It changes the shape of the part where the fetus is growing inside as well, right? So because of that, it can limit the amount of space inside there, which can then cause issues with conception. So for some people, if they wanted to have a baby, they may require some kind of intervention, some kind of surgery before they conceived, for instance. You also asked about PCOS.
Yeah, that's
Yeah.
right. PCOS.
So Yeah, PCOS is basically polycystic ovary syndrome or ovary disease. That's when the ovaries have got many, many, many little bubbles, follicles. Why it happens, we don't really know, but we know that PCOS has got strong links with diabetes.
Wow.
So, so once that diagnosis comes out, we often say start with weight loss first. Start with weight loss. Start watching a diet. Eat, you know, low glycemic foods. Cut down on the carbohydrates. Not necessarily going keto, just cutting down on the carbohydrates, cutting down all the sugary processed foods, and it does make a difference. And so I think that's the best way to go because again, prevention is way better than
Right.
cure, right?
Any sign or symptoms, doc, on having this endometriosis or fibrosis?
So
Fibroids.
they're very different syndromes, right? So PCOS is really just having many follicles and very difficult to conceive. That's what it is. Endometriosis is when okay, so the uterus, right? On the lining is what gets shed every time women have their periods. But that lining tissue is called the uh, endometrioid tissues, right? When that tissue is found outside of the uterus, then it can cause severe pain, significant pain every single time you have periods.
Right.
And you're not talking about pain, oh, take Panadol and go and sleep. This is the kind of pain where women cannot go to work. They're like doubled over. They're really in significant pains that they may need like significant amounts of pain relief every single time they have their periods. So
Right.
that's not normal, right? Because we shouldn't be debilitated by our periods. Periods happen and periods don't happen, right? But if you are in so much pain, then something's wrong there. So we might need to get it checked. Now, why does it happen? Again, endometriosis is believed to be an inflammatory disease. So again, with every type of inflammation, it's always about going back to your diet. It's always going back to your lifestyle. Let's fix the lifestyle and the disease gets fixed. Easy to say, but it actually involves sleep and
Right.
making
Right.
sure we're getting a good amount of sleep. It's about getting our diet right. So cutting down on all the inflammatory foods.
Right.
And one of the most inflammatory food is actually cow's milk. Mm.
Oh, okay.
Yeah,
Right.
so getting cow's milk out of the system as well. Then processed foods. So anything that has a label on it is processed, right? So
Right.
getting rid of that and trying to eat home cooked food as much as you can. So you have so much control over what goes into your body.
Right.
Exercise, mindfulness, all of these things, right? That makes sense because that's preventative health strategy at the very basic.
So can we say, doc, for women, right? They don't need to wait for any sign or symptoms. They should do a check, a regular health checkup every 6 months or every 1 year.
No, not necessary.
Right.
Um, I don't advocate women getting checked every single time. There's certain things that are worth checking. Yes, doing a pap smear every 3 years because that's preventative, right? Getting a breast check, so with a mammogram every year after 40, that again is preventative.
Right.
But going for ultrasounds to check and see what the ovaries, what's happening with the ovaries, all of that is not really preventative. What we are looking out for are symptoms. So if
Right.
there's a problem, then we can go digging in further. But of course, again, basic stuff is basic. Get your lifestyle checked way before any symptoms kick in, way before we are getting a diagnosis.
So prevention is better than cure. That's what we are.
Easy.
Um, so salt. We are talking about carbs. We are talking about sugar, processed food. All these are we know because, like what you mentioned, is just straight on the dartboard. Because when you're eating at home, you know what you're putting in the
Yeah.
soup. But if you're having a soup outside and it tastes so damn good, you never know what's going in there, especially with the MSG and
Oh
sodiums.
gosh. It's
It's
all
crazy.
over. It goes straight into your arteries.
Yeah. Yeah. All right. So you're gonna go again next into the cycles. Especially women, right? Sometimes the cycles can go more than 7 days. Some are not even coming for 3 months or 4 months. Should they get worried, or while they know in their green lights or the red lights, what they should know?
Okay, so cycles are usually between 21 to 35 days, and that's the cycle. Because remember, we've got winter, spring, summer, and autumn. So all of that will take about around 4 weeks, right? So if your cycles are very short, like they're 2 week cycles, that's not normal. Anything more than maybe 2 months is also not normal, right?
All right.
So if that happens, you need to get it checked. Usually women bleed for between 1 to 7 days. Okay, so that's the part where you bleed. If it's anything more than that, then again it's not normal. Okay, and after 7 days, if you stop and bleed again, that's also not normal. So we're just expecting a single period of bleeds and then it stops. That's what we expect. So typically when patients start to age a little bit around 40, 45, they may have a change in their cycle lengths, and that is expected, but it's not normal. So it's probably
Right.
worth checking with the doctor as well.
Doc, I have heard before, some woman who doesn't have their menstrual cycles for a period of 3 months, 6 months, something to do related with the thyroids and all that. Is there something that they should really concern about for their health, or is there something go to check if something delays?
Absolutely. I mean, of course, number one on our mind is pregnancy, right? But besides pregnancy, I think it's worth getting it checked because I believe that a menstrual cycle that comes regularly, even though if your cycles are every 2 months, but it's still regular, right? If it comes every 2 months and it's regular, that's fine. But if it skips a month, or if it's more than 2 months, or if it's more than 3 months, then I think it's worth getting it checked because there could be something else that's happening inside of the body, and we need to figure out what it is. And yes, you're right. The thyroid has a huge part to play. So thyroid gland, right there, it sits in the
Yeah.
middle of the base of your neck, and it runs hormones. It's our metabolic organ. So when you have got low thyroid hormones, so we call it hypothyroidism, that can alter our menstrual cycles quite significantly. Alongside, if you have hyperthyroid, so it's more than normal,
Right.
that can also affect what happens in our cycles. A lot of other things have an impact too, right? Very low iron levels. If you think about it, your blood is iron, right? 50% of your hemoglobin levels would be, oh, actually, every 1 gram of blood, you have, 15 milligrams,
Wow.
right? So half of it, sorry, not 50, math fail, 0.5 0.5 grams
Right.
of iron in there. So every 10 mils of blood, it's 5 milligrams of iron. So you lose quite a lot of iron just from your menstrual cycles.
We are going to cover a segment, a question on the iron topic, in the question coming along the way, but we're also going to talk a little bit on the blood clots. But before we go to the blood clots, to the viewers, if you want to follow Dr. Mythili Pandi's Instagram, so this is the link. If you can see that, you can actually follow her. She have very great educational videos there in her stories. I enjoy watching that. There's a little cartoons. I'm trying to figure out what they are, but I know it's related because I see what the topic is all about. But what are these animals there?
Oh, they just so some of it are parts of the body, and they're having conversations with people.
Right.
So those are my favorite. There's a T-Rex, and the T-Rex is just having jokes really.
Right.
There are quite a few others. I love puns, so that's what I do
Okay.
in the morning when I wake up. I usually try to post something interesting because I find
So
it funny.
now, okay, so now I know the secret. So please do follow her. Very great, interesting, lots of stuff over there. So I really enjoy it. Hope you also will enjoy it. We're going to go to the blood clot right now. So what is this all about, Doc? When we talk about this blood clot during the menstrual cycles, menstruating normal, is it normal?
No, it's not normal. Very simple. Answer's clear cut no. When you lose more blood than normal, that's basically your body's not able to break down the blood. So you're bleeding faster than you should be. When you
Right.
see blood clots in your period, like in your pad or your tampon or whatever, it means you're bleeding faster than you should be. Okay? And that's a problem because you shouldn't be bleeding. You shouldn't be being a leaky bucket. You're just pouring blood out all the time. That's
Right.
not normal. So we need to try and figure out what's causing it. Of course, there are things that we can do, but again, we need to dig in deeper. We need to find out what's going on. Why are you bleeding so much? And and that's where I would come in, right? So that's the kind of work that I do in the clinic.
Thank you, Doctor. We are in the 35 minutes of live topic on the topic of wellness for women. With me is Dr. Mythili Pandi. We are talking everything about women. So if you are joining us, please do share and like. And if you do have any questions, please ask us as well. We are in Spotify and Apple Podcasts. So after this topic, you can actually hear from them from these two platforms as well. As we are going to go a little bit more in deeper and deeper and deeper to find, if you have a couple of questions, you can ask us. We're also going to look into the matter of going and get checked up. All right, this could be a little bit of more emotional. And in certain cultures, if you don't conceive within the first 1 month or 2 months, oh, what happened? All these whole tail wife. But of course, nowadays the generation is like, we will have only a child after 10 years. But a couple should be worrying, right? But at the same time, some of them may be shy to get help. But your take, Doc.
Okay, so how long do you need to try and conceive before you get checked? Look, if you're above 40, don't wait. If you're above 40 and you need to have a baby ASAP, go ahead and get checked right away. But if you're below 39 and you think you might have time still, I would often recommend that you try, and try meaning you want to try and have sex in the mid cycles, right? So that's when you are releasing an egg, and that's when you can eat, well, most of the time, be able to conceive. So that's the usual time. If you can try for about 6 months or 12 months, then, we'll see. Most of the time, if nothing happens, then you might want to go get checked.
Right. Also, at this point of time, you got to say this. Globally, the low birth rate is rising up like the rising sea. That's basically because couples have very, very less time, having sexual intercourse or together because of workload and kind of stuff. So if you are in the prime time, please, increase the birth rate to rise up. If our local government is hearing this, they should be very happy because we are promoting high birth rate. Come on, get exercise at the same time, have fun, and enjoy, and then increase the birth rate.
But it's not only a women's problem, okay? A lot of times it's a men's issue. So smoking, vaping, not having an adequate diet, overheating, of course, that's another issue, right? What else? Gosh, there's so many issues. Even not eating enough, not eating the right foods. All of these.
Doctor, it's very interesting. Somehow or other, we do see cases, right? Women do accept, I got an issue, I can't conceive. But somehow or other, I'm not sure, in the male segment, male sometimes refuse to accept. I don't know why. Maybe it could be the male dominant of whatever, but beginning of one of them, I can't put them down, but accept it, go and get help. We are still men. I don't understand. Sometimes they refuse to get checked up and see what are the possible solutions and get fixed, but some or other don't. In my experiences, I have faced a couple of them, which I know. So sharing with you.
Yeah, it's quite true. I don't know why it is, but it takes two hands to clap, right? And sometimes if you need help, you need help. You can't run away from it, right? Mm-hmm. So yeah.
Thank you, Doc. We are going to go into the iron because iron is very important for ourselves, not just taking iron dumbbells and eating. No, it's a different kind of iron. Does eating spinach, tons of it, will replenish my iron?
Yeah, that's what Popeye says, right? The Sailor Man. Yeah. Look, okay. Iron, anything that's green, beetroot. People say, oh, I drink beetroot juice every day, I shouldn't have iron deficiency. But if you are vegetarian, vegan, you need a lot of support to absorb that iron from a non-heme, so non-blood product. And let me take a couple of steps back, okay? So if you're drinking or eating meat, basically you're getting heme iron, and heme iron is easy for the body to just absorb very quickly. But if it's non-heme iron, that iron needs vitamin C to absorb. Okay, so vitamin C coupled with that iron that is from a plant source, then it gets absorbed. Now, if you're drinking coffee along with your meal or having your chai or your teh tarik or anything with your meal, you're pouring all that iron, all that really beautiful iron into the toilet bowl, right? So if you're a vegetarian vegan, you really need to control how much caffeine you're taking in on a daily basis. And definitely never have caffeine with an iron rich meal. So, yes, go on.
How about alcohol, doc? Alcohol,
Again, a diuretic, right? It makes you pee, and that often helps pour everything down again.
right? So in
Yeah.
this, do you think supplement works? I mean, of course, it's a very subjective matter on everybody. But some I know in my profession, those who refuse to take tablets and say, no, you know what, I'm just going to eat naturally. But we know that 4 grams is just one egg white. So maybe if you have 2.2 grams of protein per pound of muscle,
Mm.
probably naturally you can't have it. So sometimes people do go into supplementation. But what is your take in that?
Hey, look, as long as you're bleeding, you're pouring blood down into the world. You're pouring it into the toilet bowl, into the rubbish bins, okay? So you need to take something extra and or have lots of meat, have lots of iron-rich products that are from animal sources. So something has to give. If you're vegetarian and you have heavy periods, you're emptying your bucket too quickly. Does that make sense? Right?
Right.
Yeah. So if you have heavy periods, we need to address the heavy periods and then we need to supplement to get your iron back to normal again. Um, but that is another way. So if you're someone who doesn't like taking iron tablets, there are other ways to deal with this, okay? Because most people will say, if I'm taking iron, I get gassy, I get bloated, my stool gets really hard and it's black, and I'm just feeding iron into the toilet bowl. So what we often do instead of taking an iron supplement is to consider an IV iron, and that's gaining
Mm, yeah.
popularity. And I think you've spoken to Diraj, who's my colleague,
Yeah.
and yeah, we sing the same song here.
Right.
IV iron works, and it's not dangerous, and it actually helps women get their iron levels back. So when patients are iron deficient, you are tired, you've got a brain fog, you feel like, oh, I can't remember anything, I can't see
Yeah.
clearly, I can't remember what I just said 2 seconds ago. That's I went into this room and I cannot remember what I've actually come into this room for. That's memory losses, that's concentration impairment, that's
Mm,
being breathless when I'm exercising, for instance. Uh, all of these things, hair loss, iron is
wow.
necessary for hair loss. So all of these things, we start wondering how come no one's coming in. It's because one of the easiest tests to do is to actually test the iron level, not the hemoglobin. Hemoglobin is a very anemia, right? So low hemoglobin, that's a very, very late stage of iron deficiency. Whereas if you actually test your iron, your ferritin levels, you're
Yeah.
picking it up so quickly. And once we start with a treatment protocol for your iron levels, you start getting your energy levels back.
Perfect, doc. And we talked about this iron deficiency and how they can, replenish it and kind of stuff. But apart from iron itself, is there any other things that you will also recommend
Oh,
for
absolutely.
women?
Hey, okay. As long as you've got color on your skin, and I do, um, we often are vitamin D deficient. Okay, and vitamin D is crucial for moods. It's crucial for energy metabolism. So, and when you have darker skin, most of us don't want to go out into the sun too much because you get darker, right? Or you hold an
Yeah.
umbrella, or you wear
Yeah.
sunblock on your face and
Yeah.
things like that. And that just blocks off your vitamin D absorption. And most of us work in office buildings, so we don't get any sun anyway. We start the day when the sun is just about to rise, and we leave the house just when the sun's setting. So you never get enough. We often recommend 2,000 IUs on a daily basis for a person. Did you know, actually, this is interesting. I
Yeah.
realized this. There was a study come out a couple of years in Singapore, and it says that the most common, no, so they did a study on the number of suicides. So in Singapore, and the most prevalent um, racial group that actually had most suicides were Indians, right? And out of them, Indian women were at the highest prevalence of
Mm,
suicides or attempted suicides. Then you start to wonder why. Is it because we are low in vitamin D? And because we're low in
Right.
vitamin D, our moods are just not quite the way it should be. Of course, it's
Right.
multifactorial, right? It could be
Agree.
situational, it could be this, it could be that. But I'm just thinking, just out of my mind,
Yeah.
does it make sense for us to implement a vitamin D protocol for each and every one with darker skin? It makes sense, doesn't it? Or at least just to get it
Right.
tested on a regular basis.
Yeah.
So get your vitamin D.
I mean, I totally agree, Doc. As we speak, the medical science is improving by, I don't know, it's always evolving. Something new is coming up, something organ, we have to do this and do that. There's so much of studies have to be done. If you can look over the 100 years, we have came so far where we are right now. But I think they still need to evolve, like what you said. Studies have to be done to
Mm,
find out what exactly is happening. And these can't be done in within weeks or months or
no.
years. It probably need decades to understand. And I think you said it well as well. So we is anemia and a deficiency on the iron, are they same?
It's similar. So your iron levels have to drop quite significantly before anemia kicks in,
Yeah.
right? So while it's dropping, you lose hair, you lose memory, you get brain foggy, you lose your concentration, you lose your ability to catch your breath, right? So your muscle recovery starts to get affected as well. All of these things start to get affected before it shows up as anemia, right?
Wow.
So I know it's ridiculous. As a trainer, you probably see a lot of women who are iron deficient.
Yeah.
Um,
Most of the time is feeling lethargic, and like you say, right, because it can be a multifactorial, because monthly menses may come in, exhaustion, stress. People that just have, over the past 2.5 years of COVID and now coming over here, and most of them also feeling a lot of exhaustion mentally, physically, emotionally. So I think they are now all recuperating right now. And like you talk about, this iron is also is not been highlighted most of the time. They say if you're low in iron, have spinach or carrot. It's like, okay, you have to go and talk to
Carrot,
Popeye.
carrot's wrong.
So especially old tales will say, "Oh no, eat these more, eat these more." They are doing all these Ayurveda signs or whatever. But of course, we are all learning from every individuals. But like what you mentioned is very important. So how do they test this iron, by a blood test?
Mhm. It's by a blood test. So you'd have to get a specific test called the iron studies
Yeah.
done. Okay, not just your full blood count. It's called the iron studies. And when you do a panel called the iron studies, one of the most important markers is ferritin, and that's what we look out for. Any number lesser than 50 in ferritin is something that we often want to get management for. We want to get that treated because that's already iron deficiency.
Right. Thank you, doctor. So I got a message here right now. Please don't mention my name. Of course, I won't mention the name, but I know who you are. But no worry. P and C, private and confidential. But of course, hi, doctor. Interesting topic that you have covered. But may I know, my monthly cycles are very irregular. Sometimes 2 months, I won't have it. Sometimes it's a whole month itself. Shall I get worried?
I think it's worth checking that out. I think you probably may have something like PCOS or endometriosis, and it's hard to pinpoint just by like regularity of your periods. It's worth getting that checked out, I'd say.
All right, so you got the answer. Thank you. We have Rita Francis here. Thank you, Rita, for the questions. I'm going to flash it out to Doctor as well, because viewers will put in the comment section. I can just put it to show to Doctor as well, and we can. How do you cope with PMS? Is there any food or therapy that helps to cope with the symptoms?
Oh, hi, Rita. I know Rita anyway. Yes, PMS is something that we would love to get. Just a quick fix, right? Like take this one food and it's settled. It doesn't work like that, unfortunately. Some people say that evening primrose oil may help. Again, evidence is very weak, so don't know. Is there any phototherapy? I find personally, and with my patients, that exercise helps. Getting out and about, moving, all of these things actually help you with your blood circulation. It kind of gives you a little bit more endorphins. It gets your insulin levels nice and low. And all of these actually help in the long run anyway. So figure out what's causing the PMS. Is it because of the drop of hormones? Is if that's the case, then what can we do to help that? Oftentimes is eating right. having enough iron, having enough folate, having enough vitamin B12, all of these things makes a difference. Having more protein in your diet, that also makes a huge difference, right? Um, so yes, in a in a very very large nutshell, that's my answer to you, Rita.
Thank you, Rita, and thank you, Doctor, for taking that question and asking that question. Doctor, we have covered almost about 50 minutes of podcast
Wow.
here today at Kopi Events. Very in-depth information that we talked about. But of course, we got more questions that's coming in. Yeah, Rita said thank you for the insights. Thank you, Rita. So, Doctor, yes, we have come to the last question itself. But this question is from me. So, from the past 50 minutes, I noticed that you somehow rather very holistic. You cover everything that, that you should not only wait for something to happen and then look for cure, but rather do all those stuffs for preventive, right? But sometimes some things comes just like that. And nowadays, if you look at it, one of the factors, of course, we don't have the actual numbers, we can't mention that right now, but someone who's very fit, someone who takes care of the food, no alcohol, no smoking, healthy lifestyle and kind of stuff, no stress, but just strategy just happens to them, cancer. And we know that we've been doing a lot of studies in it, and medical science and scientists are always cracking their head and kind of stuff, but can't seem to break through that. Where are we at right now, Doctor? I mean, in terms of what you know, in the segment of this topic that we talk about.
Vance, this is a very challenging question because I don't know the patient. I don't know what the
Yeah.
patient's been doing. But going by what you said, if the patient is eating well, exercising, doing all the right things, that is
Yeah.
something that we cannot change. And that's
Yeah.
the genetics, right? So if there is a patient who has quite rubbish genes, right? Lots of cancer in the family. What the best thing that you can do is to live the life that you have been given, right? So live it as well as you can. Eat the right things, do the right things, avoid smoking, cut down alcohol as much as possible, as much as possible.
Yeah.
Um, things like that. That makes a difference. That will make the difference because then you've done the right things and shit happens. So what else can you do?
Thank you, Doctor. Thank you so much. Doctor, before we end this show, of course, we're going to be live in podcast as well. Viewers can download it and listen, or even just listen to it. Do you have any final advice or tip for our viewers here?
Absolutely. So I think parting few lines. Um, it's health comes not just by doing a health screening. The health would be your health will have to come from watching what you're putting into your mouth, what you're putting into your body, exercising, and being present. And I think that's what it is. We don't want to go just floating around with the waves. You want to be living every single moment of your life, and that comes from being mindful about what you're doing as well. I can't stress enough. But I think a lot of us who are sitting on our butts the entire day just do not
Yeah.
get enough exercise, right? So getting going, getting moving, breathing in fresh air. I call it vitamin N, vitamin nature, right? I love it. I just walk into the forest and immediately I feel like I've got a whole weight just released from my shoulders. So that's something that I would strongly encourage everyone to do. Get back into nature, get back into some kind of exercise and start living, people.
Thank you so much, Doctor.
No problem.
Yes, I'm going to flash this your Instagram page so that they can
Vance,
see.
can you put it in just as at Mythili Pandi? That would make it
At
a lot
90
easier.
Money. All right. So
Yeah,
viewers, I will post it out in the comment section so you can actually look for her and then just click the hyperlink and then you can go to a web page. Doctor, we are going to catch up very soon. I mean, I need to go and check my iron as well. So just to not make sure that drinking, eating a lot of spinach, but of course, prevention is always the cure. Oh, we have another viewer was saying, thank you so much. Very informative and enriching talk, Dr. Mythili. Thank you, dear. We have more
I
coming in.
can.
Yes.
Yeah,
Oh, I think your.
Taruman
Okay.
runners.
Yes. Oh, she's from there. Okay. Oh, yes, doctor. You're also from the Tarumar Runners, also, right? You run.
I
Oh,
do. I try.
Right. So you are really a fitness. What can I call that? Not a. You don't work out in the gym, right? You do a lot
I
of outdoor workout.
do. I
Oh, you
do.
do.
I do the HIIT sessions 3 or 4
Okay.
times a week.
Oh,
And I have a gym at home, so that
right.
that is our gym workout at home as well.
5 hours in a week. Fantastic. I just love that. If everyone can just follow at least 2, 3 hours a week, I think that's very good, right?
Whatever works for them, right?
All right, doctor. Thank you so much. Very interesting topic that we have covered and spending your valuable time with us at Kopi Events. Thank you so much. We will catch up real soon for real coffee. No more
Let's
water.
do
Okay.
that. Awesome.
Thank you,
Take
doctor.
care.
Thank you so
Thank
much.
you. Bye
Thank
bye.
you. Bye. That was Dr. Mythili Pandi. Very interesting topic. We talked a lot of stuff. I know this topic can go really deep. It can span hours and hours and hours and hours just talking about it. But I think in a nutshell, I think she gave very informative informations, talking about each of these pointers that we talked about. And there is this information that is. Wait, let me just see. Okay, that's Dr. Mythili Pandi. Very interesting Insta stories, which I enjoy. She talks a lot about health, about women, especially on breasts and how to take care and kind of stuff. Very interesting. Dinosaurs, right? Dinosaurs and toys. I think she should be having all this in a desk, as a doctor. Right? She sometimes keeps it. We have more messages coming in. Thank you, Miravati. Thank you so much. That's the mom. Hello, auntie. How are you? No, doctor. All right. We are going to come back again on a very interesting topic again. I mean, I've been repeating this for how many times, right? Interesting topic, interesting topic. I mean, all these are informative sessions. And just a quick update, this was started during the pandemic, during 2020, yeah, the COVID, all right? So I had a little bit of time. So most of y'all been asking me, hey, why this, right? It's something to really enjoy. And that's on my profession as well as a fitness trainer and a fitness coach and a master trainer. So it's combination of both health and fitness comes out as Kopi events. Catch me again on the next topic. We are finalizing a few topics coming up. Very interesting. You see, I use the word very interesting. This is Vance. I'll catch you soon on the next topic every Wednesday, 9 p.m. with Kopi with Vance. Adios, amigos.